Thanks, Riley. So let's see. So for those of you who were able to log into Thinkific, you by now are familiar with our framework here. As Melissa mentioned yesterday and on the video online, this is based off of Bronfenbrenner's ecological theory, in which we think about early childhood development and sort of all the layers of relationships and systems and programs and people that influence the family and child there at the center. And you also know that we are sort of at the beginning stages. We're in chapter 1 here on Thinkific. You all completed some foundational knowledge around maternal and infant health, early brain development. We also learned about early adversity and its effects on the developing body and family stress and how that affects development as well. Again, now we want to take just a few minutes. You can pull out your, I don't have mine handy, I wanted to pull out my Early Childhood Fellows notebook that you all received in the mail, but we invite you to pull those out. You might reflect on what you learned in Thinkific and think, as I said, we were broad in Thinkific, how can we get specific about the issues within the districts you represent and the states that you're from. So let me pause here. I'll give you just a few minutes to get specific. All right, hopefully you've got a few ideas down. We're going to ask you to hold on to those and we'll come back to them in a little bit. Right now, I just want to highlight 2 really important resources that you might be interested in checking out later. Excuse me. These are both really valuable resources that can give you specific information on your state. They both track a lot of indicators on health, family, economic supports, and opportunities, early learning with, as I said, specific data to your state's profiles that help you understand sort of how exactly the families and children in your states are doing. These will be linked on the slides that you can check out later. We'll also provide them in a recap email later, but just wanted to draw your attention to these resources out there that can help you as you begin to understand sort of the lay of the land in your states. But we're going to shift from there now, and we're going to look at the policy implications of all of those issues and barriers. We're so excited to have Dr. Cynthia Osborne here with us today. As you can see from all the accolades here, Dr. Osborne is very busy, and we know that she's got another big event later today, so we're just really grateful to her for being here. Dr. Osborne was the founder of the National Prenatal to 3 Policy Impact Center. We've had the opportunity to partner with her several times since the launch of her center. And as I said, going to focus on the policies here, what the research says about effective policies. And she is just a wealth of knowledge. So please, any questions, feel free to drop in the chat or unmute. We want to really tap into her expertise while she's here. So I will stop sharing and hand the floor over to you, Dr. Osborne.
Well, thank you, Jenny. I really appreciate it. And I'm really grateful to have the opportunity to speak with you all today. At the end of the day, what we are doing is in service to you. And so if the resources that we're providing are useful, that's great. And if they're not, we want to hear from you so that we can make them more useful for you. And I was asked to talk about kind of the policy landscape, about what effective policies help to improve outcomes for infants and toddlers and their parents. And so I'm going to share my screen and begin by just giving a broad overview of what we have done to really investigate that question and the policies and strategies that we've identified that are most effective. And then after, we'll pause there and let you ask questions, although please ask questions along the way if you'd like to. And then I'll share with you what policies look like across your states. We also have lots of information on the well-being of your children, because at the end of the day, why we care about doing any of this is so that we can improve the well-being of our children and families. So I am going to share my screen here. So I'll just begin with what I call our guiding principles of kind of what we're trying to do and what we're all about. I'm an academic. I'm at the University of Texas at Austin, and our work really relies on the science of the developing child. I know that many of you were able to view some of the materials and have heard from the other speakers about this science and how it has evolved over the last decade or more. But it clearly identifies the conditions that children need to thrive from the start. But what we heard as we talked to state leaders is that they often lacked guidance on what the most effective policies or strategies are that states could implement to actually help to create these conditions. So we turn to the most rigorous evidence that we can find to identify what these effective policies are. But we do recognize that the evidence base that currently exists is limited and that there's so much left to learn. So that's part of our commitment as well. We also know that there's no one program or one policy that can do it all. So we started with this systems level perspective, and you'll see if you looked at our clearinghouse that we've reviewed over 24 state level policies to really look kind of broadly at what's working and what we need to learn more about. I'm not going to spend time on the science of the developing child because I know that you guys have gotten those materials, but this is really what motivates our work. And at the end of the day, we are trying to create the conditions that create those safe, warm, stable, nurturing environments, both for the parent and child, and when the children are not with their parent, between any other caregiver and that child. We know that those sorts of environments are what lead to self-regulation and executive function. And when children are faced with chronic adversity, that they're in constant survival mode and not able to really develop in the way that they are pre-programmed to do so. It's not as if we should ever give up on a child. There are things that we can do if we don't get it right, but it's a lot less expensive and a lot easier if we get it right from the start. We also know from the science that we have to care for the caregivers in order for them to care for the children, that the children are not independent, especially our infants and toddlers. And that we looked for policies that help provide the knowledge and skills and resources for parents so that they could be the providers that they really want to be for their children. And we've also looked to see how we can do that for childcare providers as well. And I'm happy to talk more about some of the needs that our childcare providers have. And like I said, it really does take a system. The research is clear that there is no magic bullet. There's no single institution. It's not education or childcare or healthcare or social services or employment or the family alone, that they do work as a system, and that the stronger it is, stronger the system is, the better off our children and families are. But this system requires both broad-based supports that meet the basic needs of families, allow them to both work and care for their children and have sufficient resources, but also a combination of targeted interventions that really meet the specific needs that families and their children have. We've also learned from the research that we have to be intentional if we want to create an equitable access and opportunities for our children, that is something that we have to really pay attention to as we think about improvements in our systems and implementations of our policies. So the Prenatal to 3 Policy Impact Center, we are hoping to provide 4 primary resources to the field. And like I said, you are our primary target audience. We are doing this in service to you so that you can make evidence-informed decisions about what meets the goals that you have for the children and families in your states. We, like I said, created a policy clearinghouse in which we conducted comprehensive reviews of the most rigorous evidence to date. And they're all there to demonstrate what it is that we know about what works and what it is that we still need to learn. And from those comprehensive reviews, we identified the 11 most effective state level policies and strategies that really create those conditions in which children can thrive. And I'm going to spend time on the policy roadmap today, which is the compilation of those effective policies and strategies. But just to briefly mention, we want to continue to build that evidence base and to help states understand how they can implement these policies to reduce disparities and make sure that all children have the opportunities and access that they deserve. But creating this is just one part of our mission. Getting it to you is the second part and the most important, because if it's not used, it really doesn't have the value that we think it can. And so we are working closely to build relationships with state policy leaders so that we can better understand what your needs are and to provide you with the information that might be helpful to you. So I'll begin with to just briefly describe our state policy roadmap. And the framework is really simple. We began with the science of the developing child. We turned to the research to say, what is it that actually works? And then we're monitoring states' progress, not just toward whether you are adopting the policy or not, but really about implementation. How generous is your policy? What is the reach of the policy? And how is it being implemented and funded so that it can really be as effective as possible? And we're also tracking 20 different outcomes for your children and families in your states, because at the end of the day, again, that's why we're doing all this, is to lead to better outcomes for them. The science of developing child does tell us exactly what those conditions are that children need to thrive. And we've put those into 8 policy goals that are both broad and more targeted. So just briefly, these have to do with making sure that folks have access to the services that they're eligible for, that parents have the ability to both work and care for their children, that they have economic stability and housing and food security, that children are born healthy to healthy parents, and parents have both the physical and mental health that's necessary in order to be the parents that they really strive to be, that they understand what to do with their children and how to create those nurturing, warm environments for their children. And when children are not with their parents, that the child care providers and others also understand how to create those nurturing relationships. And that when we do identify our children's needs, when there are developmental delays or any other needs, we identify those early and we get them to the services that helps over the long term to reduce their long-term needs. So that's the science of the developing child. Now, what are the most effective policies? We identified 5 policies and 6 strategies. And I can go into great detail or not much detail, depending on your level of interest. And these are the ones that the most rigorous research to date says actually lead to improvements in these outcomes. So they include making sure that families have access to health insurance, reducing administrative burden, and we use the example for SNAP or food stamps, paid family leave following the birth or adoption of a child of at least 6 weeks, a state minimum wage that is at least $10 an hour today, and a state earned income tax credit that's refundable and at least 10% of the federal earned income tax credit. And we put these floors on there because that's what the research to date says is necessary in order to get the outcomes that we want. States that are increasing their earned income tax credit, but don't make it refundable, are not necessarily getting the bang for their buck, if you will, and having the biggest impact that they could through that policy. The 6 strategies are much more targeted in their interventions. And we are redefining this year how we measure kind of whether a state is actually fully implementing these strategies or not. But the distinction between a strategy and a policy is they are both effective. The most rigorous evidence tells us that these things work. But with strategies, the evidence doesn't really tell us how you should implement that. How much should you fund home visiting in order to have the reach that is needed and to really create those positive parenting outcomes, for instance. So we are still studying this to try to learn more to provide that guidance to you if these are the strategies that you want to implement. But to date, the research isn't as clear. But these effective strategies include comprehensive screening and referral programs like Family Connects or Healthy Steps, childcare subsidies that ensure affordable access to high quality care, group prenatal care models, evidence-based home visiting programs that really target parenting, early Head Start, and our early intervention services, or Part C. All of these are effective at helping to improve outcomes for infants and toddlers. And as part of our state policy roadmap, and I encourage you all to see it, and we have one for each of you in your state so that you can see where you stand on it, we demonstrate how those effective policies are aligned with our goals. And again, those goals are not things we made up. Those are the goals that the science of the developing child say are necessary to create those conditions. And so you can see where expanding access for health insurance is associated with 5 of our policy goals, whereas reduced administrative burden. Let's see, this says I'm muted. I'm not sure. Jenny, am I still on? Okay.
You were muted briefly and then came back on.
Okay, I'm sorry, I'm not sure exactly what happened, but thank you. But that you can see where the different policies are aligned with different goals. And so what we suggest is that, or what in our conversations with state leaders, we ask you what your goals are and then provide you with the information that we have about the various policies and strategies that help you to achieve those goals. Or you may be interested in a particular policy or strategy, and we want to provide you with the evidence about why that's effective and how it can be implemented as effectively as possible. So this is that alignment between the policies and the goals. And in the interest of time, I don't want to go through each of these. I just want to point out that in our state policy roadmap, for each of these policies and strategies, we go through the specific evidence that the research, the causal evidence that the research says these have the potential of impacting for infants and toddlers and their parents. And it's broken out by goal. And you can see that some, such as for expanding Medicaid, is associated with 5 different goals. And it is an example. Medicaid expansion is associated with reduced child neglect. And that would be the evidence is there in our state policy roadmap for each of these for you to really see how it's related. This is an example for a reduced administrative burden for SNAP and how lengthening the recertification period to 12 months, what it does with regard to increased participation among SNAP. Paid family leave and the 6 different goals that it impacts. And so for each of them, I can take you through the specific evidence. And again, for state minimum wage and the earned income tax credit. So I want to pause there and open it up for any questions that you have about the evidence per se, and happy to dig into any details. And then start again to talk more about the state progress and how this looks across states and the variation in terms of implementing these policies and strategies. So I'm going to stop sharing just to open it up for any questions that you have at this point. See if I, and if you type anything in the chat, I can see that as well.
Feel free to unmute or drop questions in the chat. If there's any policies specifically maybe that you saw on your own state's roadmap that you would like Cynthia to focus a bit more on, now's your time to ask. Go ahead, Senator Moran.
Thank you. That was a packed bunch of information. I really appreciate the sort of linear analysis, very concrete. A picture paints 1,000 words, very, very well presented for what I can only imagine was just a Herculean effort that's still ongoing. And I'm just, curious, even though that was so much work and so much information, do you have any suggestions or maybe something in the future where there's an ability to sort of plug in cost strategies? In other words, to place a bang for the buck kind of element in, because of course, I think, most people here will agree, we're always, struggling and competing for, for financial, ideas. And so that's where I'd like to take this if you can.
Absolutely. That's the question that we get. And in the first year, we didn't have all that information there. In our kind of comprehensive evidence reviews that are on our website, there is a place there that does talk a little bit about how much these cost and what the return on investment is. But this year, and this year's roadmap that we'll be producing and will be coming out in October, we've really tried to dig into this question. So both, how much do these different things cost? What is the return on that? And then how do states fund it and the variation in that? We don't have all of the answers for all of the policies yet. Some of it really hasn't even been studied, but we will be sharing what we know. For return on investment, the strategies, the program interventions, those have been able to study more carefully what the exact return on investment is for a program like Centering Pregnancy or Family Connects and so forth. There is kind of wide variation in what the return on investment is for something like an earned income tax credit or state minimum wage, because the impact varies based on the level of generosity within your state. So what is your minimum wage and so forth. And it also varies based on the kind of value that you put on the different outcomes. So there are employment outcomes, there's health outcomes, there's social outcomes, and the research kind of adds those things up in different ways. So it's not quite as clear cut as it reduced the number of hospital stays, for instance, by this amount. So that's a very professorial way of answering that. It's complex, but it's definitely the most important question that we're trying to answer as we move forward. And when we talk with states, learning about how you're funding these and what's working and what's not is one of our top questions.
Thank you.
This is Ralph Alvarado, and really that's the question that we have as well. I mean, I'm a pediatrician. I know the value of a lot of these programs. Minimum wage is obviously a very heavily debated issue across the country. Cost of living plays a big factor. I mean, what a minimum wage is going to be in New York City or Los Angeles is not going to be how it's going to be in Owsley County, Kentucky, which frankly, those lower wages, people actually can live and can actually survive on that and do okay. So it makes a big difference, and it can add to the competitive disadvantage. But anything you can do as far as this is what it's going to cost per child on an average, something along those lines, because ultimately when we propose a lot of these, and some of these, I'm looking at I got my computer screen here and I'm looking at Kentucky's current, what you guys have proposed. I saw this last year when you all put it out, and some of those ideas have been proposed. There's always some resistance on some of those, and it's always a matter of when we go to our appropriations and revenue chairman to say, hey, we want to implement this. Well, how much is that going to cost? And they want to see quick results on that, on that investment. We know in healthcare, sometimes you have to wait a while to get that return on investment. We say an ounce of prevention is worth a pound of cure. But we need to have those numbers if you're going to convince other members of the General Assembly, at least here in Kentucky, to get some of these things implemented. Is they want to see what's the cost up front, how much is the savings, how quickly do we see those savings to get those policies implemented. Otherwise, it does become difficult. And anything you can do, even if it's an average cost nationwide or something, or even again weighted based on states, would be very, very helpful to be able to get a lot of those policies moved through.
Yeah, I really appreciate that, Senator. And the issue of the short versus long-term returns is something that those of us who are in early childhood, really grapple with all the time, right? That we know that there are these long-term benefits to early investment, but you have to put out the kind of fire in front of you. And so that is one of the things that when we look through here, we're really looking at the benefits that accrue as much as possible in that prenatal to 3 period. So the kind of immediate benefits that it has to the children in that age group. And there's some things that we don't actually include in our reviews about some of the longer term benefits. The earned income tax credit is an example in which children who are exposed to it early have benefits throughout their educational journey. So I do hear you. Making sure we're clear about what the short and long-term returns are and how much it costs is just essential. So I'm happy to continue. Oh, please. Hi, I'm sorry. Susan, I'm sorry. I'm not sure what your title is, so I would call you by your title. My apologies.
Yeah, Representative. I just do have a question. With your earned income credit, I noticed you went to age 3. Was there a reason? I just wondering what the thought was to end at age 3 as opposed to 5 or 6 or whatever.
So we are the Prenatal to 3 Policy Impact Center. And so everything that we do really focuses on those first 3 years of life. And it's not because we don't think 4 and 5, 3 and 4 and 5-year-olds are essential. And we do have some information on them. But what we were seeing is that there was a lot of information about our preschool age kids, but not as much about those kids in the earliest years. So this is just a way to really focus attention on those first 3 years, but it's not meant to send any signal that the other ages are not important. And we do have some information on the older children as well.
Thank you.
And the nice thing about these policies, although they, we're saying here's if you have the goals of making sure kids get off to a healthy start, they have an impact. They actually do have impacts across multiple age ranges, and it's not just for infants and toddlers. So they often, can serve multiple purposes. So I'll continue to share my screen, and you will have access to my slides. So I don't want to, let's see if I can pick back up where I was. I don't want to, go into every detail here and bore you to death, but but what you can see is that there's just widespread variation across our states in terms of the number of policies and strategies that states are implementing currently. These data are based on our the roadmap that we put out in 2020, and we are currently in process of gathering all the information from all the sessions that you have just completed. Some of you will be ongoing and continue to make changes, but everything will be updated in our 2021 roadmap that will come out in October. But in our state policy roadmap, what you would see is that we know that policy is a long game, and that it's not very common for a state to just introduce something and it passes and it's implemented right away, that there is a process of discussion and moving that policy toward adoption and then finally toward implementation. So our numbers are often different than some other groups' numbers because we really only count you as a yes if families in your state can currently receive that benefit. And we demonstrate for each policy and strategy where your state stands on this kind of barometer, if you will, of passing policies or really implementing them in a way that allows for a broad reach of them. So that's what these color-coded from dark red to dark green mean. And then for each of the policies and strategies, we indicate where your state is along that barometer, so that you can see where you are and where other states kind of around you are. I'm in Texas, and so that one's always easy to find on the map. These maps are a little bit, different because we want each state to have the same size square, but it's not always easy to figure out, where your state is on this. So I'll give you a second to see it. But that for each of our policies and strategies, we go through to indicate where they are. And then we also provide a host of information on various policy indicators, both your generosity and your reach. So for instance, this is an indication of the income eligibility that parents have in your state for Medicaid. And this is as a percentage of the federal poverty level. The blue states have all adopted Medicaid expansion, and therefore they're at 138% of the poverty level, or DC that has increased it to 221%. The gray states are those that haven't adopted Medicaid expansion, and you can see the level of income eligibility that a parent would have to meet in order for the adult to be eligible for Medicaid. It's a low of 17% in Texas and a high of 100% in Wisconsin. And then in your state's roadmap, you have an example, information on where your state stands on these. And we also give some indication of the well-being that's associated with this, or the reach that's associated with this. So this is an example for Rhode Island. They have fully adopted Medicaid, and families at 138% of the federal poverty level parents are eligible for that. And that's associated with pretty low levels of lacking health insurance. In this case, the range is from nearly 48% of low-income women of childbearing age who don't have health insurance in Texas, up to a high of 5.4% in the best state. And we do this again for each of the policies and strategies, and have some sort of indicator of something that we might be measuring to see if the policy is in place, would we start to see some of these things change over time? And this is an example of the percent of families who are eligible for SNAP, families with children under the age of 18 who are eligible for SNAP, but who are not receiving it. The darker blue states tell us whether they have a 12-month recertification period or not. The gray states do not have a 12-month recertification period in their manual, if you will, by statute. And there's a real range across states in terms of the reach of these policies. For paid family leave, there were only 5 states as of last October in which families could actually get the benefit, but there are 10 states who have adopted a policy in which families will be eligible for that benefit very soon. Rhode Island's a state in which they do have one of the longest standing paid family leave programs, but it's currently only 4 weeks for based on a child, instead of the 6 weeks that the research says is really imperative in order to reap the benefits that the research finds. Again, with state minimum wage, this demonstrates to you the range of the minimum wages in nominal, or the actual minimum wage. But in the state policy roadmap, Senator, we also have the cost of living adjusted minimum wage, so you can see kind of where your state stands with regard to that, and what it might need to be if it had at least the value of $10 an hour. So this is a wide range here. And then for the earned income tax credit, there is not a measure about the number of folks within your state who are eligible for the credit and who get it. What we do know is the proportion of folks who are eligible for the federal EITC and who actually apply for it or don't. So this is the generosity of a state's earned income tax credit, meaning the percentage of the federal credit. And then we have another indication of kind of the proportion who are not filing their taxes. And if they did, they would be eligible for this credit. And you can see in Rhode Island, there's 15% of eligible filers who are not filing. But at the end of the day, this is my last slide, what we found by tracking your legislative sessions on these policies and also on the strategies, but there are 35 states who were really seriously considering or passed, may still be considering one of these effective policies. And again, the state has way too much information on it, but it is, the takeaway is that states are making great progress. I know all of you probably a year ago were very concerned about what our state budgets would look like given the pandemic. And so we were really amazed by the level of effort and a kind of generosity that states put forth to really strengthen families this last legislative session. And we're heartened by the fact that so many states moved forward and that our budgets didn't end up being quite as bad as we all feared. But I'm going to, again, stop sharing my screen and open it up for any questions, but also just extend an invitation to talk to us about anything that you may want. We do have more information about some of the funding. We do have information about how states are funding it. Obviously, NCSL is an amazing resource and partner with us and all of that. But if there's any questions or folks that we can talk to in your state, we really welcome the opportunity.
Cynthia, I have thank you for being here. On the SNAP recertification piece, I know there was an extension, I think in one of the COVID bills, but just sort of curious on the cost side of it. I'd imagine it's probably somewhat neutral because it saves on administrative costs, but do you have any data on states that have done that and what the cost implications could be?
Yeah, that's a great question. And you're right, the pandemic did make it so that folks were extending those recertification intervals or allowing for a much easier way of recertifying. So we were able to learn a little bit from that. Obviously, everything else was different, but we were able to see that. But it does reduce administrative burden, reduces administrative costs. So the fewer times that folks have to come in to the office and meet with an individual and show those papers and all those sorts of things, that is a cost to the state. There is certainly an importance of ensuring that people, only people who are eligible are getting services and so forth. So some sort of administrative, interventions or safeguards are really important. But what we find is that by reducing administrative burden in ways like increasing the recertification interval, it doesn't lead to greater fraud, and it really reduces the costs that states incur. And maybe even more important, it makes it so that families who are eligible continue to receive those services that they need. SNAP is one of our most effective programs at reducing food insecurity, and that longer recertification interval is kind of a pretty simple way of making it so that children and families still get those benefits that they're eligible for.
Thank you. And I just had one other quick follow-up question. The question is quick. It may engender a longer response, but one of the things that we've been grappling with in our state and a whole variety of different programs is sort of the benefit cliff phenomena. I was just curious if you and maybe we can follow up later, if you have any data or if you're all doing any research on states that have done a really good job and sort of creating a slope instead of a cliff, or how that factors into things.
Yeah, that is a really important question. And we are currently actually doing a study to look at how these combination of resources within a state actually kind of work together, and whether by, say, increasing your minimum wage, that reduces the amount of SNAP, for instance, that you would be eligible for. So there's partly just how these combination of policies interact to, you'll go higher in one, but maybe reduce on another. But the benefit cliff, as most of you know, we have income eligibility thresholds that are often pretty absolute, at least from the federal standpoint. If you make $1 more, you're no longer eligible. Something like the earned income tax credit is a different policy that actually intentionally tries to avoid that cliff by saying, if you earn up to this amount, you get this sort of tax break, the maximum. But then as you earn more and more and more, you're going to get less of that tax break until you earn about $80,000 a year. And so that's that slope that you were just referring to. Most of our other programs do not offer such a slope. But what states have done is, by using kind of continuous coverage and longer recertification periods, for instance, in childcare, there was a federal statute that required that you can't kick a kid out of childcare just because the parent got a job that now makes them ineligible by, a couple $100 or something, that they have to be eligible for at least a year when eligibility is determined. And other states have done that for other sorts of benefits as well. So they will go back and look to see, but it gives folks just a little bit longer of a runway to, and more of an incentive to get those jobs that pay higher wages when they're not just immediately cut off of the benefit. I don't know if I answered your question well, but it's a very important topic because it can lead to disincentives for folks wanting to earn more if they know they're going to lose their health insurance, for instance.
Thank you. Yeah, I'll follow up with you. And Allison, thank you for posting that link in the chat.
Senator Harvey.
Thank you, Cynthia, and thanks for your talk. This information is a little overwhelming. I have a lot of questions, but you said you are coming out in October with an update, and I'm just wondering how you're going to account for the COVID pandemic in your data. I know that in my state, and I'm sure with probably every state, we've both been in a pandemic, in a crisis, but also things have been more generous because of all of the influx of federal funding. And so how are you going to account for both movements of things being worse, but things being better at the same time?
Yeah, that's it's a challenge. If we started this in, we got our initial funding in April 2019. And obviously by the time that we got our legs under us in March 2020, we all had to go home and we needed to rethink everything that we were doing. And this year has been this combination of both tragedy, but generosity, and trying to account for all of that has been somewhat difficult. The main thing that we track is states' adoption and implementation of the policies. So that is something that we are able to see in real time. And there are usually states have noted whether they have made a temporary increase in some sort of benefit level, and whether they'll reconsider that, say, when things start to look better post-pandemic. So we're able to track that a little bit with regard to actually the policy and the implementation of that. With regard to spending and how folks are spending, childcare, Texas is $4.4 billion in childcare spending that we have to do something with. And that is fantastic, but it's not the status quo. And so we're trying to really understand how states are spending their American Rescue Plan dollars. We don't know if the American Family Plan will make things permanent. So a lot of it is kind of learning and guessing and staying in touch with what might happen. But we will be noting that in the roadmap. Now, a fortunate thing about national data is that they trail in time. So our outcome data are all going to be pre-pandemic. It's all 2019. It's going to be a while before we really understand what this pandemic, the changes that it brought for our families. There's some amazing studies in real time. They're rapid studies, but kind of the national trend data we won't see for another year or two. So the outcome data are really going to tell you, how your families were doing before the pandemic. But the generosity and reach, we're trying to track and indicate, whether this is a temporary or a permanent change at the state level.
Okay, that's good. Will you be doing anything? I'm just thinking about I'm from Vermont, and we've struggled with trying to implement paid family leave. And it's the one thing that we don't have on your chart. One of the things that seems to have happened during the pandemic is that unemployment insurance has actually worked kind of like paid family leave in a lot of cases. And I'm wondering if there's going to be any research that might use that as a sort of marker of what would happen had there been paid family leave, if you know what I mean.
Yeah. No, that's a really great suggestion. And I haven't seen that study in place. I know that folks have been looking at the impact of the higher levels of unemployment insurance on things like employment and food insecurity and housing and those sorts of things. But to think of it as a substitute of what it might look like if for kind of parents of newborns and newly adopted and fostering children, that hasn't been done yet. And so thank you for that suggestion. I'm going to see what we can do about that. That's a really great one.
Great. Thank you.
Yeah, thank you.
Well, thanks everyone for the dialogue. We'll have a few more minutes for more questions in a little bit. Right now, we're going to head into some smaller group discussions to give you time to sort of digest what you've just learned from Cynthia and talk with one another. We know that these sort of peer conversations are always really beneficial to folks in the program. And so Riley is going to send us into breakout rooms. You'll have one NCSL staffer, and I think we've got a few folks from the Prenatal 3 Policy Impact Center who might also be in there and can help answer questions. We'll have about 15 minutes, a quick round of introductions. If you want to change your name underneath your image so that we can see your state and your title, and turn your camera on, we can have some time for some small group discussion, and then we'll come back and Cynthia will still be with us for a few more questions after that. So go ahead, Riley. Thank you. And we'll see you shortly.
You should also feel free to either put in the chat or I think our email address was put into the chat, but we can do that again to reach out to us to asking specific questions. I know in my breakout group, there are a few specific policies that folks wanted to know more about, what the evidence said about a paid family leave, earned income tax credit, for instance. And so please, again, that's what we're here for. And I have heard you loud and clear about how important it is to be able to tell you more that we know about funding and so forth. And there's still a lot of good information there now, but more to come for sure.
And Jenny, I would add, I'm Jenna with NCSL. In our group, we talked quite a bit. Multiple states are struggling with infant toddler capacity issues, broader ECE capacity issues. I think every state is struggling with infant todd capacity and care issues. So we just kind of were talking about different legislation that people are carrying or considering, just some of the data that they're collecting on their own states, and really being struck by the lack of care that is available.
Yeah, I think that this is going to be a problem for a bit, and issue that you all know, we need to solve because our parents want to go back to work and we need them to, and they need childcare. I think that in the short term, we may see some easing on these capacity constraints because the federal government has provided guidance to states that we can use the shorter term ARPA dollars to increase wages for childcare providers and kind of try to build up that childcare provider workforce. These are folks who typically make right around $9 to $10 an hour. Some states are more, but most states are right around that. And they have really struggled. Providers have really struggled to kind of meet their margins, especially for infants and toddlers with low ratios. One of the things that's also adding to some of the constraints, and this is a discussion for a larger discussion for another time, but as states are opening up their public schools to 3 and 4-year-olds and using their dollars to fund more universal pre-K types of programs, that is often taking our 3s and 4-year-olds out of our childcare centers, and they subsidize our infants and toddlers. They're that you can actually make money on it, 3 and 4-year-olds, and you can't on infants and toddlers in terms of cost margins. And so what we see is states being very mindful of that and getting creative about how to make that kind of not be the reality. In Texas, for instance, we're using both subsidy dollars and public school dollars to and keeping the kids in the child care center and sending the dollars to the child care centers so that they can keep them open and they can use the dollars for infants and toddlers. It's not simple. Blending and braiding of dollars is something that few of us know how to do well. And other states have changed to more contract based so that they're getting paid more based on kind of enrollment versus attendance in order to keep those repayments a little higher for infant and toddler care. So there's a variety of things that states are doing to try to offset that, but the combination of the pandemic and the 3s and 4s really is putting pressure on infant and toddler care. Let's see.
Cynthia, you have a really good point. We're going to spend a lot more time on childcare in Chapter 2 when we meet again in July. So I thank you for sort of teeing that up for us. One more question we could from Senator Hardy in Vermont. I'm not sure if you can see the chat, but she's wanting to connect the policies and strategies with equity.
Yeah. Thank you for that question. In each of our policy reviews, we pay a lot of attention to whether the policy is closing the gaps in outcomes or maintaining the status quo and just kind of improving things for everyone. Not all of the research speaks to this. That's something that we're really calling for, is that we need to do a better job of being clear of what the racial and ethnic differences might be. But we also have an equity initiative within our Impact Center in which we are trying to identify the specific state policy levers that states can choose to implement that would create greater equity. So I'll use paid family leave just as a brief example, but there are trade-offs between the amount of reimbursement, that level that you would give, the number of weeks, and who would be eligible. And kind of thinking through the equity issues within those trade-offs is really important. If you make your reimbursement level too low, that's not going to allow people who earn the lowest wages to be able to take advantage of policy. If you exclude certain workers like migrant workers or workers with irregular hours, you're going to exclude certain ethnic populations in a lot of states. And so states are kind of grappling with what are the choices that we want to make the policy choices that create the greatest equity or inclusion that we can. But those are the things that we're trying to disentangle and provide greater guidance on for states.
Thank you so much for the great conversation, everyone, the great questions. Really thank you, Cynthia, for making time for us on this busy day. I know a couple of your staff are going to be sticking around, and we've certainly got your contact information that we'll be passing along. So please do follow up with questions to the Prenatal 3 Impact Policy Center staff. We are going to take, let me just share my screen real quick. Maybe. We're gonna take a quick break. Very important that you see this slide here. We've got 5 minutes, so please don't log off. Just, you can stop your video if you like, but just stay on the line. We've got 5 minutes for a water, bathroom break, quick stretch. We'll be back at 11:20. Thanks, everyone. Welcome back. Welcome back.
All right. Yeah, we'll give everybody just a second to pop back into your spots there. I think everybody should be back now. And thank you so much. We got so much great information today. That was a lot that we packed into the morning or the day or whatever time of day it is for you, wherever you are in the country. So I just kind of wanted to take a minute to kind of gauge how everybody's doing and what you got from today. So we're going to do a quick question here for you. And I just want you to respond by, we're calling it the fist of 5. So a fist would be a 0 all the way up to a 5, which would be like, yes, a lot. And so think of it as like a Likert scale using your hand. And your question is, did you learn something new today that will inform your work to support families and children in your state? So if you wouldn't mind showing me a fist to 5 with obviously the fist being 0 and then the 5 being like, yes, I'm so excited to bring all this information back to my state. So what are we saying? Okay, I see lots of fingers. This is good. Oh, I see a couple 5s. I like that. Okay, great. Well, thank you all so much. We hope this was useful to you, especially the policy speed rounds. We know you didn't get a whole lot of time, but hoping that we can continue conversations in future sessions. So what's next? Oh, sorry, before we go on to that, I also just want to quickly note that if you happen to miss our meeting yesterday or any part of it, or you just like to revisit it, just this morning, I got a word that recording is now up on our website. So for the Fellows Program, so you can go to that site and click on the June tab, and then you can find the recording from yesterday if you'd like to get back to that. So, okay, what's next? What's coming up next? In 1 week, about a week, we're going to be releasing the data, the information on Thinkific for Chapter 2. So that would be more modules for you to review in your own time. Hopefully that was helpful for you for Chapter 1, a couple more quizzes, things like that to get you geared up for Chapter 2. And in Chapter 2, we're going to be covering early learning environments, including things like housing and homelessness in early childhood, equitable access to high quality learning, the early care and education workforce, and school readiness. So we're going to reconvene next on July 14th and 15th, again at 12 p.m. Eastern time for about the same time frame as we did yesterday and today, where we're going to dive into policies that are looking at early childhood mental health and the early care and education workforce in particular. So we also like to kind of take a moment here. We've kind of been alluding to touching base and sharing resources. So we kind of want to gauge your interest in some office hours that would be set completely optional between now and that meeting on July 14th and 15th. So if we can pull up that poll quickly, just kind of want to see what you think. This could be talking further about some of the information you shared today. It could be maybe revisiting some information from the policy speed rounds that you weren't able to attend since we had 4 of them, but only 2 sessions. It could be looking at and talking further about some of the information that we'll release on Thinkific for Chapter 2, or perhaps getting some of those experts from the Thinkific modules to come on and have some informal Q&A. So, and again, this is completely optional. It's not required. We just want to kind of gauge your interest to see what people are going to be thinking and feeling about this. If you'd like something like that, we're happy to provide that for you on July 1st or somewhere around there before our next set of meetings. Okay, it looks like there's still about 34% of people had voted, so we'll give you a little bit more time to give more people a chance to chime in. We'd like to gauge that. And certainly if we don't meet, we can still provide you some additional resources and things that might have come out of the policy speed rounds, or some questions or follow-up resources from Dr. Osborne as well. Okay, we've got 57 who have voted. We'll give you just a few more seconds to chime in. Okay, it looks like that's kind of slowing down a little bit. So yeah, I guess we can go ahead and whenever you feel like you're ready, you can close the poll. All right. Well, thank you for taking a minute to share that information. Like I said, we want to make this useful to you, so I appreciate you giving that feedback for us. So, okay, before we let you go, we're almost done for the day. Just have a couple of learning opportunities coming up from NCSL that we wanted to let you know about. So the first one.
Hey, Melissa, real quick, I'm just gonna say, it looks like we were pretty evenly split on the to attend or not attend. So just stay tuned, I guess, and we'll provide information about whether that will be happening and how to join.
Okay, thank you. Yes. Thank you for taking the time to share that with us. Okay, so coming up next, just to again, kind of give you a quick glimpse at some other learnings coming up outside of the Fellows Program. We're partnering with our education colleagues in the early education team to offer a boot camp that are all things early learning workforce, which we know is a really hot topic right now. So this is open to all legislators and legislative staff, and we'll explore opportunities to grow the essential workforce and ways to improve teacher preparation and support. So you can register at the link that Jenny's going to share in the chat, or Allison's going to share in the chat for us. So there's the link there to register if you'd like to attend that one. A couple of days later, on June 24th, you can join us for an exclusive briefing for state and local policymakers from the Federal Administration for Children and Families on how your states can use the nearly $24 billion in child care stabilization grants through the American Rescue Plan Act. And Allison's also going to drop that in the chat for us. And finally, you've got a presentation coming up on June 29th to learn more about the complexities in the child welfare financing, as well as how to leverage funds through the American Rescue Plan Act again. And Allison will share that link with us in the chat as well. So just wanted to alert you of those additional learning opportunities coming up. We hope to see you at one of these additional offerings. And that's it for today. Thank you so much for all of your participation and great questions and discussion with everyone. We look forward, or look for an update rather, from as soon as Jenny mentioned about whether or not we'll be hosting some office hours or some sort of learning in between. And please feel free to reach out to us at any time between now and then with any questions or for any additional resources until we meet again. So thank you so much for joining us.
Thank you.
Thank you.
Thanks, everyone.
Bye.